Products are shown for demonstration purposes only. The AHA does not endorse or recommend any specific manufacturer or product. In order to show skills clearly, the healthcare providers in this video do not always use recommended personal protective equipment, such as gloves. To help improve your assessment skills, the American Heart Association training series includes videos of actual children with medical problems. And of course, at no time was medical care delayed for the purpose of obtaining this video. All children received timely and appropriate medical care, and parents provided consent before recording. Welcome to the Pediatric Systematic Assessment video. In this video, we will focus on evaluating your patient, identifying the presenting problem, and providing appropriate interventions. Once you've performed the interventions, you'll repeat the process by reevaluating the patient and identifying whether the problem has resolved or worsened. Then you'll apply additional interventions as appropriate. Because the child's condition can change rapidly, you'll need to repeat the Evaluate, Identify, Intervene sequence, or EII, frequently throughout the assessment process. The first step in systematic approach is the initial assessment. It's what you first see and hear when you immediately encounter the child before you touch the child. You'll quickly observe the child's appearance, breathing, and circulation. This will determine your next actions. The Pediatric Assessment Triangle, or PAT, is a memory aid to help you recall the components of the initial across-the-room assessment.
The first thing you'll observe is the child's appearance. This includes his level of consciousness and ability to interact. If the child's unresponsive, you should shout for nearby help and then activate the emergency response system. Then you should check breathing and pulse and provide rescue breathing or CPR if needed. The next part of the pediatric assessment triangle is evaluation of work of breathing. Is there an increase or decrease in rate or effort? Is it normal? Or are there audible respiratory sounds? After breathing, you want to look at circulation, which will tell you how well the child is perfusing. This includes skin color and pattern or obvious significant bleeding. Always remember, it's a life-threatening condition if the child is unresponsive or apneic, has inadequate or labored breathing, or is mottled, gray, pale, or cyanotic. You'd want to immediately call for help and begin life-saving treatment.
If there's no life-threatening condition, you'll proceed with the primary assessment. But now, let's practice the PAT, the initial assessment. You'll watch a scene that represents an emergency situation you might encounter. Then we'll stop to let you make your initial assessment.